Good afternoon, everyone. Thank you for being here today with us in another session of Vitrolife Group Academy Studio. So it is my pleasure to introduce you my colleague and friend Bruno Korpersky, who is going to talk about Smart PGTA Plus. So Bruno, please, whenever you want,
Thank
the
you.
floor is yours.
Thank you so much, Nasser. It's a huge pleasure for me to talk about the Smart PGTA Plus. And we're going to show a little bit the things that we are doing right now and the novelties that we do have regarding our current PGTA. So when we think about the Smart PGTA Plus, it's our most advanced 4-in-1 genetic test that offers an increase accuracy and also confidence for the embryo transfer. Because when we talk about the Smart PGTA, we are talking about our current PGTA that we are going to aim the analysis for the trisomies and also the monosomies. But also, we can incorporate with this analysis the SNP analysis, and we are going to incorporate the ploidy analysis. So in this part, we can discard when we have triploidies or also aploidies. But when we are talking about this new version of our PGTA, we are talking about the plus, we're talking about also the embryo quality. So we can see about the contamination that we do having in this analysis, and also we're gonna have the siblings QC that we're gonna provide. So when we think about this and all these four analysis, we're gonna have the PGTA, our current PGTA, and regarding the ploidy and the embryo QC, we're going to need the analysis of the SNPs, the single nucleotide polymorphism. And we're going to do this analysis for every single embryo that we are going to perform. So we have selected a 357 SNPs that we created a custom NGS panel. So in this SNP, we're going to check if completely this embryo has a triploidy or has an aploidy. So how does the Smart PGTA works? So we have our current protocol of biopsy. It is the same that we are having. We have the blastocyst biopsy, we have the tubing, everything exactly the same. But when we perform the DNA amplification, we're gonna have two aliquots. So we have one aliquot that we're gonna perform the PGTA, the current and normal one, and the other one, we're gonna perform the SNPs analysis. You're gonna have the one report as usual. In this report, you're gonna have it, the aneuploidy analysis, the ploidy analysis, and also the QC embryo analysis. And we're gonna provide the transfer of the health embryos. So what are the indications for the Smart PGTA Plus? While any couple could benefit from the Smart PGTA Plus, the following indications are specific relevant. When we think about the rescue of embryos following abnormal fertilization, say for instance, I have presented an oral presentation here at ASRM, and we saw that we can rescue a few embryos regarding 1 p.m. and 3 p.m., and this is so important for our patients. Reproductive history of aploidy and triploidy, and also recurrent miscarriage or sporadic miscarriage after conventional PGTA. Complete or partial molar pregnancy, this is so important when we're talking about the triploidy analysis, and also patients with a severe male factor of high rate of diploidy in sperm. Well, as we can see, when we can think about the ploidy analysis, we do know that the haploidy and the triploidy are both compatible with the pre-implantation embryonic development. And we know that the triploidy can be found in around 10% of the chromosomally abnormal spontaneous miscarriage and is usually not compatible with the developed to term. Well, but what does the embryology say? So when we check the pronuclei, we see that when we have the two pronuclei, we call it the normal fertilization, but we also have the abnormal fertilization, when we have the 0 p.m., the 1 p.m., the 2.1, and also the 3 p.m. So in this paper, our colleague Jose Miravet presented at the PGDIS, we can see that we have an incidence of triploidy in 1.8% of all our samples. So it's a low incidence of triploidy, but it's an important one because we know when we have a triploidy, we have a higher risk of abortions and everything. Regarding also another abstract that we presented, this time at ASRM with our colleague Laura, we can see from different pronuclei checks, we can see the abnormal fertilized oocytes, we have different rates. So when we talk about the 0PN derived blastocysts, we do have a rate of 93.2 of diploidy embryos. When we talk about the 1PM embryos, we can see that we have like a rate of a 35.6% of diploidy. And when we have embryos that more than 2 PM, we do have a 33.3% of diploidy. So the ploidy analysis and the genetic PN check gonna increase the diploid candidates for transfer after abnormal fertilization or no fertilization, and also gonna decrease the transfer of embryos with the ploidy abnormalities. When we talk about the contamination detection, the contamination can mask the true chromosomal status of the tested embryo. So the undetected contamination can lead to erroneous results and potential misdiagnosis. The PGTA Plus detects an admixture of exogenous DNA, external and also maternal DNA, and our detection ability for contamination levels is between 10 to 90%. We have estimated by our studies that we can have like a 0.8 of all the trophectoderm biopsies can be contaminated. So when we talk about the siblings relatedness, we know that the embryo fingerprint without the need of additional samples from the egg or the sperm provider. So this is really good importance because we just need the embryo biopsy to perform it. So with this analysis, we can assess the genetic relatedness between an embryos in a cohort. We can confirm that all samples analyzed originated from embryos fertilized by the same egg and the sperm source, and we must have 2 diploid embryos. Apparently, in our studies, we can see a mismatch detected around 0.2% of all the samples, and we know the cause for this apparent mismatch, it is embryos derived from different donors and also the true mismatch, incorrect embryo biopsy and tubed. So, to conclude, with our PGTA Plus, we can reduce the risk of miscarriage due to the previously undetected abnormalities. We can increase the number of viable euploid embryos available for transfer. We can enhance the accuracy by reducing the risk of misdiagnostics through the implementation of external DNA contamination detection. And we can provide a definitive confirmation that all embryos within the same patients are genetic full siblings. And also ensure the enhances efficiency and quality control in laboratories procedures conducted within the IVF lab, providing a great assurance. So thank you so much.
Thank you very much, Bruno. There's any question? So I know that you yesterday had another lecture, a similar one.
Yeah.
But you had a different kind of percentages.
Yes, we did. Okay.
Because time lapse or not, can
perfect.
you develop a little bit?
Thank you so much for your question. This is a really good one. In our current work, we analyzed the embryos that we are for sure know the pronuclei status because they were cultivated by the time-lapse system. And this is a really good importance one because we have 100% sure that the embryo is a 0PN, a 1PM, and a 3PN. When we talk about the 0PM, say for instance, we do have a different results that Laura has because all of them were completely in true 0PN. The thing that when you don't have the time-lapse system in your lab, you don't always can be like that 100% sure that the embryo is a 2PM or a 3PM. And this is why we had a different type of results. Say for instance, when we talk about the 3PN ones, we do have a slightly less down rates regarding the triploidy, but this is a really good importance to regarding like the mixture of between the PGTA and also the time-lapse system.
Do you have any information about 4PN embryos?
Thank you so much for your question, but right now we don't have it. We don't have it. In our study, we just analyzed the 1 PM. Laura analyzed the 2.1 PM and the 3 PM. but the 4 p.m. no.
Anyone else? Okay, Bruno, so thank you very much. I'm struggling with my voice. And thank you all for being here today, and see you in the next session. Thank you.
Thank you.